How you doing? Welcome to our next episode of our webinar. My name is Paul Scallon, and I'm one of the clinical lead physiotherapists for IPRS Health. And joined with me is Ashley James, a colleague who's also one of our clinical leads for IPRS Health. What we're going to do today is we're going to talk about what we call the painful elbows. And what we're going to talk about a bit more specifically is a term that we use as lateral elbow pain. And one of the most common lateral elbow pains that we get is something called lateral epicondylosis, and for the layman's term, that's tennis elbow. We've all heard the term before, tennis elbow. And we get a large proportion of people coming in with tennis elbow problems in all industries, in industries that base in offices, to your kind of industries of working in industries such as car industries or your manual where there's a lot of manual handling. So we're going to have a little chat about this, and we're going to go straight into really to show you tips on how to manage it yourself, how to reduce pain, how to prevent it in the future, and we can open up a little bit of discussion at the end if you want to ask any questions. So, just to get a bit of interaction, what we're going to do is we're going to put it up on Twitter at the moment. So if you have Twitter, can we encourage everybody just to get your phones out or go into your computer and open up your Twitter, and if you search for us at IPRS Health, and what you'll do is you'll find our page, and if you can ask us any questions you want to. So we will be as interactive as we can. So throughout the whole webinar, if you have any questions that you want us to answer, just go onto our Twitter accounts, type in your question with the hashtag IPRS Health Webinars, and what we'll do is we'll answer whatever questions we can at the end. We're also going to be doing a little bit of a poll at the for this webinar. So again, if you have Twitter, open it up now. So we'll give us a good bit of feedback, and it'll be interesting to get some results on this. So that we're doing a poll. You can answer this on your Twitter, and it's, in your experience, what have you found works best for tennis elbow pain? So if you've had tennis elbow before and you've had treatment, or you've gotten advice, what works best for you, or what have you found works best? And that's your options is it's slightly different on Twitter, but it's ultrasound therapy, acupuncture, exercise, and massage are your main options. So if you can go on Twitter and then have a go at that poll as well, it'd be great, and we'll feed back the results at the end. So what we're going to talk about today is we're going to go through a few different. We're going to kind of go straight in to see how we can help you guys and what advice we can give if you have tennis elbow or how to prevent it. The next one we're going to do is how can you reduce those early symptoms of tennis elbow. And a common question that we get as clinicians from our patients is, do I need a scan? And that's a big one. Another really important topic is what we call good load versus bad load for tennis elbow. We've also got, we get a common questions again about different types of modalities or different things that can help with the pain. So splint, supports, and less with therapy, we're going to have a little bit of chat about. We're also going to have a chat about risk factors of what potentially can cause tennis elbow, and also about work, risk factors in work and how we can change it in work. So we've got a few different options in terms of tennis elbow treatment. So a lot of people will ask us, what's the best treatment to have for tennis elbow? And there's loads of different options. We're going to go through them kind of briefly now so you can see. Some of you might have had positive experience with certain treatments, negative, and we're going to give you, based on our clinical advice, but also more importantly what the medical evidence shows. And the first one is exercise. And what we know, exercise has got the highest level of evidence supporting a reduction in tennis elbow pain and an improvement in function in terms of strength and movements. So if there's a gold standard for treatment, exercise is the gold standard. And how it does what it does is it stimulates the tendon remodeling. It basically strengthens the tendon. It builds it to be able to withstand the force that it needs to. And exercise is what we would term as a good load. So that's a good load that we encourage you to do. The other options we have is what we call change loads, or you'll commonly hear load modification. And this is another really important advice that you need to get for tennis elbow. We're going to talk about this a bit more in detail later on, but basically this is just about getting the right balance between that good load and that bad load, which Ashley's going to discuss about later on. We've got other ones called, you've probably seen treatments of hands-on treatment. So hands-on treatment would mean, some people may have experienced this before, it's massage, manual therapy, and manual therapy would be like your mobilizations, your manipulations. So with these ones, there are benefits to them. there's a bit of a debate over it at the moment, but there are short-term benefits to these options. But what we've got to be very important and clear about is that there is no long-term benefits to having these hands-on treatments. So the big message with the hands-on treatments are, yes, you can use them as part of your treatments, but they shouldn't be the sole treatment. If you go to get treated for tennis elbow and they're only doing hands-on, it shouldn't be like that. So what we do as physios is we will generally give maybe a little bit of hands-on treatment just to reduce the pain short term to allow us to progress with the exercise a lot further. Take it, Ash.
Yeah. So this is something I'm going to talk about a little bit later on. Hello, everyone. I'm Ash. This is something I'm going to talk about a little bit later on. But again, so everything we're going to see in green now are what we would term short-term benefits. So that, like Paul has just said, with regards to the hands-on treatment, the taping and the splinting can be useful, but only in a short space of time.
Yeah. We also have what we call psychosocial factors. This is an important one, and with tennis elbow, tennis elbow is pretty localized to our elbow. We know it's related to certain movements. We can kind of attribute it very much to a structure in the body that's causing that pain. And if we think outside the box, it can be a bit more complex than that. And to keep it as simple as I can, what we know, pain is a construct on the brain. So the intensity of pain that we get is perceived through the brain, and there's loads of different factors can influence that pain. And you've probably been in a situation before. If you've had tennis elbow before, you've probably went on Google and you've Googled tennis elbow, and you've gotten these crazy stories or these crazy theories that your tendons are about to snap off and all these different stuff. You've probably talked to some friends who've had tennis elbow so common. You've probably had some friends who've had it, and they've told you that they've had tennis elbow for 5 years and they weren't able to do this and that, and it was the worst thing they've ever had. Or you've probably even had a certain health professional give you probably not the best advice, and that's all had a massive influence on how you perceive your tennis elbow pain. And what that'll do is it can cause you to avoid certain movements and to avoid that good load. It can make you think that the thing is worse, that the injury is worse than it is sometimes. It can increase stress, anxiety, which will increase pain. And it basically just changes your beliefs about pain, and that has a massive influence even on something as what we can think of as a simple tennis elbow. We've also got steroid injections, which is, a lot of people know about steroid injections because it is something that has been used traditionally quite a bit in tennis elbow, especially through GPs and with the consultants and so forth. Steroid injections, they are an anti-inflammatory, and they do have short-term benefits. So steroid injections have a very short-term benefit, but what we know is that there is a kind of a very poor long-term relief with steroid injections. So although you get that, in a lot of cases you get that short-term relief, long-term it's not good with the evidence is telling us. And what we know as well is that there's a high recurrence rate of the tennis elbow pain following a steroid injection. So one study showed, which is massive, 72% recurrence rates within 1 year of tennis elbow. So it's quite big. So we generally tell people to avoid steroid injections unless it's really a last option. If we've tried all the different solutions and steroid injection and it hasn't worked, then possibly we can look down to the steroid injection. We've got ultrasound, so Ash is going to have a quick chat about this one.
Yeah, so ultrasound is what we would call a passive treatment as well, and it's one of the electrotherapies along with shockwave therapy. So the theory behind it is that it aids in tendon healing, but what we've found in the research over the last few years is that's just not the case. It has pretty poor overall long-term results, as all the other things do in green have, and even with their short-term benefits, they only have found a benefit if it's coupled with exercise. So if it's just a treatment that's performed on its own, it's very, very ineffective. So again, the same as hands-on treatment. If you're going in to see a therapist and all they're doing is massage or all they're doing is ultrasound and you're not doing any exercise along with it, then you're very unlikely to make any gains.
You'll also get people asking about anti-inflammatory medication. As physiotherapists, we can't recommend medication, or certainly we can't prescribe medication unless we're qualified, but we can provide advice around it. Anti-inflammatory medication, we don't recommend anti-inflammatory medication in the very early stages, what we call the acute stages of an injury. So in that very initial phase when you get the pain between 0 to 72 hours, so the first 3 days, we don't recommend taking anti-inflammatory medication if possible, because it does alter or affect the natural healing process. Because inflammation is the first phase of our healing process. So in that very early stage, we don't recommend it. There is some evidence and research to show that your basic anti-inflammatory medications, such as ibuprofen, has a good effect on reducing pain following that period. And that's up to yourself. You may need to get clearance or advice from your GP or your health physician before you decide to take that medication. And obviously, it's going to treat the symptoms and not the cause. And Ash, we got acupuncture.
Yeah, so acupuncture, again, is very popular among physiotherapists. Again, it's in green because it gives you that short-term effect. Again, it's only effective if you use it with exercise and possibly modify your load. So you can see a theme that's starting to emerge with these short-term therapies in that, you know, that if they're performed on their own, they're largely ineffective and they only work for a short amount of time.
Yeah.
Now, PRP injections it's in red because it's a little bit different, because the evidence, so it's different from a steroid injection, it's a different type of injection. And if you're offered PRP injections for lateral or tennis elbow, you should be saying no, really, because the evidence is pretty unequivocal for PRP injections in the lateral elbow that it's largely ineffective. So that's why that one's in red. And then the last one, surgery, is in blue because we just wanted to differentiate it between everything else. You know, it's very, very rare in lateral elbow pain, very rare. Most lateral elbow pain will resolve either on its own or in combination with conservative management, so a combination of all the things that you've seen there on the screen. Surgery is the very, very last resort and certainly isn't something that you should be thinking about straight away or even, in the short to medium term with regards to lateral elbow pain. It's very much a last resort, and only if everything else is completely failed, and usually if there's something else going on as well.
Yeah, perfect. So you can see, as I said, there's a theme there. So in the purple, your exercise, load modification, getting the right advice from the appropriate healthcare in regards to psychosocial factors are really your gold standard of treatment, and then all the green can be used as in conjunction, but never on their own. Right, so a lot of people ask us, particularly in that early stage, or when they get a flare-up of tennis elbow, what can I do to reduce the elbow pain myself? So there's a few things. So Ash is going to run through these quickly with you.
Yeah, so the initial thing there, and this is a nice way to remember it, is the police strategy. So we need to start policing injuries. So it comes from the old RICE principle that you've probably heard of, so rest, ice, compression, elevation. And it's just a development of that, really. So the police stands for protection, optimal loading, which we'll talk about in a short while, ice, compression, elevation. So essentially the ice bit hasn't changed. Ice is good in terms of pain relief, just the way it stimulates the nervous system. It helps to reduce that painful feeling. Compression and elevation for the same reasons. Now, optimal loading is something that's particularly important with lateral elbow pain because it's the tendon that's injured, and tendons like to be loaded. If we don't load them, that's when we get pain, and if we load them too much, that's when we can overload the injury. So optimal loading is really important in terms of tendon pain, and that's why seeking help from and advice from a physio is really important when you get this problem. And that protection alludes to sometimes that load modification that we talk about, so protecting the injury for a short while from the things that aggravate it the most, if possible.
Yeah. And it's kind of all, you'll notice a recurrent theme through here because some of them are extremely important tennis elbows, so we really want you to understand the message. So this one basically is just load modification again. If we can identify what irritates it or what aggravates the pain in the elbow, change it, modify it. If you're able to take yourself out of that task, and you have that opportunity, take yourself out for a short period, or if you can't take yourself out of that task, reduce or change what you can do. There's a couple of examples. So if you think in an office situation where you're working on a computer, certain people say that they get a lot of this tennis elbow pain when they're typing for long periods of time, and we recommend just changing the pattern. So maybe set an alarm on your Microsoft Outlook to get you to move out away from the desk every 30 minutes, or just to change your arm position or stop typing every 30 minutes. Taking those frequent mini breaks, we call it. Rotate your jobs around, so just move around, do some printing or go your meetings, or just stop sitting at the desk for those long periods of time. And if none of those work, getting a workstation assessment, which we do at iPress Health, so maybe seeing if there's other factors that we can do to reduce the load, such as maybe giving you things like a handshake mouse or an ergonomic keyboard, things like that, which may help in being a bit more comfortable. In a more of a job where you're doing a lot of repetitive movement, a bit more manual work, like for example assembly work, or we would say, if you're using vibration tools, to maybe use the two hands or use the other hands to change your lifting technique. So sometimes if you lift with a straight arm, it puts a bit more load in that tendon, but if you bend the elbow and lift, you'll find a reduced load in the tendon. So little things like that, and that's why you need to have a discussion with your physio about how you can modify those tasks. Exercise, obviously, we know is one big thing for reducing pain and improving function. There are certain types of exercise that have an effect on reducing pain, and we call these isometric exercises. We're going to show you an example of this later on for tennis elbow. As we know, the splint supports the tape. They have limited evidence, short-term relief, but they can help. Some people swear by them, some people don't find them make any use. It's really a trial and error with them. Certain of my patients find these tennis elbow straps help when they're doing those activities that irritate it, or certain patients might find our physio taping techniques help a lot more. So it's an option for that short-term relief. And then as you get improved, obviously we need to load it. So keeping on the exercise theme, you need to progressively load with progressive strengthening, and that's going to really make that tendon stronger and prevent it from coming back in the future. And again, recurrent theme, stress, anxiety, overload of work, high pace of work. Sometimes you just need to take yourself out of that stressful situation and manage it. And what you will find amazing is that it does have a massive effect on the pain that you have, even at the elbow. Okay, so what we're going to do is we're going to have a quick chat. A lot of patients ask us about scans for the tendons. So I kind of ask, do they need to go for a scan, or that they've had a scan? And I suppose, I don't know if this will surprise some people, it may not, but what we know is that you'll hear a lot of people saying wear and tear, which it's the same as degeneration. So the term wear and tear and degeneration is the same. Any degeneration of a tendon is a normal aging process. It's not anything out of the ordinary. It's not any different to you gradually getting a few wrinkles on the skin. It's just an unfortunate stage of healing, of aging, not healing. So when we get scans, we will always see a bit of degeneration as we get over an age of 30, 40, and that's normal. It's not nothing out of the ordinary, and we shouldn't be too worried about that. Okay, there are studies, I'm not going to go through this, but there are studies around this, but what we know is that this wear and tear, this degeneration of a tendon, it isn't correlated to the pain that you get. So studies show that patients with degenerated tendons had no pain or no weaknesses. So therefore, if they have degeneration of the tendon and they have no pain, we can't correlate the tennis elbow to that degenerated tendon. And we also know that improves pain and function does not correlate to changes in the tendon on scans. So if you do a rehab program with us over a period of time, you're like, yes, my pain's gotten better, I'm much stronger, brilliant. And you've got a scan at the start and you've got a scan after the rehab program, and there's no difference in the tendon. It may still show that degeneration, so therefore it doesn't correlate to the tennis elbow pain. So really, we don't really recommend scans unless we feel that there's something else causing that pain. And that's one of the main reasons you need to go to a health professional, such as physio, is that we're qualified to assess it, and we can assess and see, well, is this a tennis elbow, is it not? Do you think you need a scan because there's something else going on? And if we know it's a tennis elbow, we wouldn't recommend for a scan, we would rehab you.
Yeah, so this is where I just wanted to this is where I just wanted to talk a little bit about that load. And it's a fairly straightforward diagram. Comes from a great physio called Tom Goom, and he talks about it in relationship to running load, but it rings true with tendon loading as well. And this is just to reiterate that there's that place in the middle, that sweet spot there, that good spot in the middle, where we need to be loading the tendon. It's just to reiterate that rest isn't what we need, because as you can see there, tissue underload happens when you have no activity. So if you get pain in your elbow and then you just think, oh, I'll rest it a little bit, what will happen is you might get a reduction in pain. So you'll get a reduction in pain, But then as soon as you go back to doing any of the activities that you need to do, it might be daily tasks, making a cup of tea, picking the kettle up, it might be work. As soon as you go back to those tasks, what you'll find is the pain will still be there because the tendon won't have had chance to do any of its cool healing stuff. So we need to load it so that we get that, stimulate that tendon healing process. And equally, if we go too far the other way, so if we go to our maximal activity, so if we all of a sudden spike our load and start doing way more than we have done, so that's traditionally where you see tennis elbow is people don't play tennis all year, and then all of a sudden in the summer everyone picks a racket up and they start playing tennis. That's where the term tennis elbow comes from, is because people spike their load too quickly, and that's when they overload the tendon and get pain. So whatever activity we're building up to needs to be gradual, and if you gradually build up to something, there shouldn't be any activity that's off limits really, as long as you gradually build up to it, and we shouldn't underload it when we get pain. So it's just to demonstrate that we need to stick within that sweet spot in the middle.
Perfect. Can you go through this, Ash?
Yeah. So again, this is just to reiterate, this is just a little thing off Twitter that myself and Paul liked, and it's just to remind us that, you know, the one thing that works is load. So it's just reiterating the previous slide that if you get pain, really think about if you're 2-3 weeks into a program and you think, well, it's not really getting anywhere, have you actually loaded it enough? Have you done more than you would normally do? Have you loaded that tendon enough? And that's just a good way of thinking about it.
Yeah.
And we've got isometrics in there as well, which I think we're going to go through now as well, which is a good way to start a rehab program if you're in a particular amount of pain, because it doesn't involve a lot of movement, but you can still get a significant amount of load through the tendon, and it's also been shown to have a good pain relieving effect.
Yeah. So loads, what we've been talking about, so exercise is a load, and what we're going to give you an example of 2 different exercise programs. I'm not going to go through every single exercise with you, but we're going to show a couple of them on a video format so you can see, and we'll also give you the opportunity to send this program out to everybody who's on the webinar at the end of this webinar. So this is what we call the phase 1 we would use in a tennis elbow rehab, and this is very much just to maintain that mobility, to do some of these isometrics that help reduce the pain and keep the muscle contracting without irritating it. So there's a couple of ones here. So I'm going to come out of this presentation and show you the isometric wrist extension. So just bear with me 1 second. So in this exercise, sorry, I'll just mute this. So in this exercise, you can see wrist and trap. What we're doing in this is that we're not pushing into pain. We're pushing up to the threshold when the pain begins, and we just work just before that threshold. So we work just before it becomes sore.
We're just losing you a little bit, Paul, for signal, so I'd probably just turn the video off. I'll make it smaller.
You hold. Sorry guys. So what we do is with that exercise, we push against the top hand, we hold it for 45 seconds, and you're working into that relative pain-free range. And then what we recommend is doing about 5 reps of that, 45 seconds for each rep. You do about three sets that you can. You can do 3 times over the day, depending on depending on how sore it is. The important thing with these exercises is that it doesn't create pain afterwards. So if you find that sore 12 hours later or 24 hours later, that means that the load was too much. So it kind of was going in a little bit into that overload slightly. So we just need to maybe hold it for less time or push it for less, not as hard, or we reduce the reps or the sets. So if you don't feel pain afterwards, continue with it. If you do feel a bit of pain 12, 24 hours later, reduce it slightly and then just continue progressing with it. The other exercise that we have is, so we've got shoulder rolls, neck rolls, we've got that isometric. This is a simple one here, gripping the ball. So your tennis elbow, most people will probably relate to, is that when you grip things, it's sore, and that is one thing we need to rehab. So getting a tennis ball, gently gripping it to that threshold of pain. So just when the pain starts, work just before that threshold, hold it into that threshold for 45 seconds. You do that about 5 reps again. Do that a few times a day, depending on how sore it is. Once it doesn't create any pain 12 to 24 hours later, then continue doing it that way. But if it does create pain afterwards, obviously we modify the load and reduce it a little bit more. You've got a shoulder exercise because there's correlation between elbow pain and shoulder pain, and you've also got what we call a radial nerve glide. Because when I play the video, it's affecting reception. I won't play the video now, but what we'll do is we'll give out our details at the end. If this is a program that you're interested in taking, we can send you this program, and it'll be in the video format, so you can see the video. It'll give full instructions, and it's a very safe program to do for tennis elbow. The other phase we have is what we call the strengthening phase. So this is phase 2. So this is where we've gone past that painful phase, but now we need to load it more. We need to get that good load in there to remodel the tendon and to make it stronger. So things like, and this can vary, this is only an example, things like modified press-ups, where really the lady's got her hands flat on the floor. In tennis elbow, I'd usually recommend kind of a fist press-up, so your wrist is more neutral. You've got a rotator cuff exercise is the second picture, and then you've also got a wrist extension exercise. So that's where you're simply using a light weight and lifting the hand up and down in a controlled motion. You've got something called supination. All these exercises loading a little bit more now and just getting it working, and you can work into a little bit of pain as these exercises. Again, we can send this program out if you're interested. So if this is you've got tennis elbow for a longer period of time, it's not very sore, this might be more relevant for you to use this type of exercise program. If you've never done any of these exercises before, if you're not sure about exercise, we can send it to you. We probably recommend that you book in with one of our physios if you're on site or have access to IPRS Health, or maybe you book in with a physio, a local physio with you to go through these exercises to show you do it properly. Okay.
So this is what I was talking about before. So we're just going to look a little bit more closely in a little bit more detail about these short-term gains. So you can put them all up if you want, Paul. So just go to the end of the slide, yeah. So again, looking at tape a little bit more specifically. So again, as I said before, there's no long-term benefits. There's short-term benefits in terms of pain reduction. There's no adverse effects. So what they found in the research is, it's not going to do you any harm. So if you have had tape on before, or you have tape on and you like it, don't worry about it. It's never going to cause you any harm. What I would say is as well, particularly with the pink tape that you see on there, different physios have different kind of fancy ways of putting the tape on, and some people say that's the best way and this is the best way. There's no specific taping technique that's superior to another. So there's no research been done that's shown that one way of taping it is more beneficial than another. The tape being on your skin is what is going to modify the pain. So that affects your nervous system, and that affects the way that you perceive pain. So just the fact that the skin is the tape is on your skin, that's what helps with the pain reduction, rather than the way that it's done. Splints, so they've been shown to have short-term pain effects over the first 4 weeks of pain, no long-term benefit, and they're not effective without strength training as well. And the same with support, so they're actually less effective than a splint, short-term pain relief, and again, not effective without the addition of strength training. Same with acupuncture, same with massage. So what I would say about all these interventions is, it's like scratching an itch. So, if you've ever had an itch, what it's like. You scratch it, feels a little bit better, but the source of the itch never, doesn't go away because you've scratched it. It's still there. So what we're trying to do with the exercise is treat that itch. So exercise is the ointment that you need to treat that itch, rather than just scratching it all the time with these adjuncts of tape, splints, and supports and things like that. That's not to say they're not beneficial, and if you've had them before and they've worked for you, then great. But if you want some long-term resolution of your pain, as well as not having to rely on other things, you want to be able to manage it a little bit better yourself, then exercise, load modification, and deal with any psychosocial factors is the best way to go about it.
Yeah, perfect. So we're going to have a quick chat about risk factors. These are general risk factors and work-specific risk factors. Again, a recurrent theme around here. So we know certain risk factors for deafness, and one of them is sudden change in activity. So a lot of time when we're as physios, when we're assessed, and one of the big questions we'll ask, has anything changed in terms of what you were doing recently? So that could be, has anything changed that maybe you were doing some gardening over the weekend, or if you're doing some sort of weekend exercise that you've upped it a little bit more, you've changed it, or you've started training for a marathon, or anything different really is what we're looking for. That's a big sign, and that is definitely a risk factor for tennis elbow. Those risks, those sudden changes can actually become quite small and trivial sometimes. So a lot of people say no, nothing has changed, but actually when we assess a bit more and we ask a few more questions, it can be something very small. Other things: decreased physical health, which I can't even spell apparently. Sorry. So decreased physical health is your general conditioning. So your physical conditioning. So if you are kind of training on a more regular basis, if you're keeping active on a regular basis by walking every day, or doing some sort of hobbies or activities on a regular basis, or if you train with sports or in gym, probably less likely if you do it on a routine basis to develop some of these tennis elbow problems than people who don't do any physical exercise. There are what we call systemic risk factors. So there's people with things like diabetes, high cholesterol, that can increase the likelihood of developing tennis elbow. Menopause, changes in hormones have an effect on increasing the likelihood of tennis elbow. And obesity, it's not a direct risk factor, but is an indirect risk factor. So there are physiological changes in the tendon in people with obesity that have a potential of increase in tennis elbow. Work-specific risk factors. These are risk factors that we can identify that maybe are higher likelihood. Now, this doesn't mean that you're going to get tennis elbow if you fall into this category. It just means that the likelihood there's an increased likelihood, and maybe something you can look into changing or modifying in the long term. So we know anything where you've got the twists, the wrist, bend and extend the wrist in a repetitive motion against the force, you're at a higher likelihood. And if I'm being a bit more specific about that, that's if you're doing those activities for more than 50% of a normal working day, which is quite a lot. And those activities, repetition means that if you're doing a cycle of those movements in less than 30 seconds, so it's quite fast, quite repetitive over a long period of the day. So as a knockout, working in a knockout environment, when we assess these, a lot of people probably in these kind of repetitive jobs think they do fall in a category, but very few times they do fall in this category. What we do find is people who probably do a bit of overtime, or their job changes, or they cover somebody else, they kind of fall into that category where they take on more work, and sometimes they fall into this risk factor. In terms of you're in an office situation, the evidence says 80 to 100% of your normal working day of repetitive typing. And again, that's something that most people go, yeah, that's me, definitely, I'm typing all day. But actually, if we record you throughout the whole day when you're typing, and then record our accumulation of how much time you typed, it's never usually that high. So that's a very high amount of typing that would be a risk factor. However, it is a risk factor, and if you are in that category, then it's something that needs to be changed slightly by modifying that load.
Yeah.
Repetitive.
Sorry, go on, Paul. No, I was just going to say with all of these, as Paul said already, just because they are risk factors and you may do a job that involves those doesn't mean that you're going to develop lateral elbow pain. No. It goes back to that sudden change in activities again. So if it's a job that you've been doing for 30, 40 years, and you've never had lateral elbow pain, and you haven't changed a job recently, and you haven't changed anything outside of work, it's very unlikely that you'll develop lateral elbow pain because you'll be conditioned for the job. You would have gradually built up to the level that you need, and you'll be used to that load. So your optimal loading part, your sweet spot, will be in the middle where it's supposed to be, rather than underloaded or overloaded. Sorry, Paul, I just wanted to make that point.
Yeah, no, perfect. And again, and on that fact as well, these risk factors are the risk factors. If you've had a previous history of tennis elbow, and then you fall into these categories of these risk factors, you're at a much higher risk. As opposed to if you've never had tennis elbow before, these risk factors aren't, you're not as high a chance of developing tennis elbow. The other thing is repetitive forceful gripping. So that's where you have to grip against the force repetitively. So, squeezing hand tools, manipulating objects where you have to squeeze them. And it's quite high. So if you think the evidence says 2 minutes of repetitive forceful gripping every 2 hours. So that's an accumulation of 2 minutes every 2 hours. And the other one's vibration. Again, more evidence and research needs to go behind it. And this is it's moderate to high levels of vibration. And that is a recommendation of more than 2 hours per day of moderate to high levels of vibration. Can increase the likelihood, possibly. Most jobs that use vibration hand tools have them already checked by health and safety, and the majority of these hand tools actually fall in the low category, the low level vibration. So very rarely, except for some of your jobs where you have to use such as utilities where you've got to use high vibration tools, you would use moderate to high levels. So that's just an example. So if you have tennis elbow, for example, and you fall in some of these categories, it may be something that you can look at and change and discuss with your manager. What else we got? Okay, so in terms of work, so this all kind of keys in. So what we got to do is, we get a question asked quite a lot: do I need to stop working? Do I need to just stop working and give it rest? And that's the big question we get. And this is why you need that advice from a physio or a healthcare professional in this area. And what we always recommend is activity modification. So as Ashley described earlier about the loads, good load versus bad load, if you just stop doing your movement completely, you're going to fall into that underload category where you decondition the tendon, and then when you gradually come back into your movement or your job, you'll overload it quickly. So what we recommend is modify the load is the most important thing. So identify the tasks or the activities that aggravate your symptoms, and that could be the gripping, the lifting, typing, using a specific tool, or whatever sport you do. The first thing we say to that is, can these tasks or activities be avoided or limited just for a short period of time? So in that very early stage, can you change it? Can you just do a different task for 1 day, 2 days, 3 days until the pain reduces? If the answer is yes, just reduce it for a short period of time, allow the symptoms to settle. You may not even need our help as physios. That may settle itself after that period. If the answer is no, then what you need to do is consider, right, what can I do to modify these tasks? What can I do to change these tasks in order to reduce those symptoms that I get, reduce the aggravation of the symptoms? So there's a few things you can think of around this area. So lots of times we've recommended this. So you've got people who do certain tasks with the one hand. They'll come in, they'll say they've got the tennis elbow on that one side. We'll ask them about their tasks. For example, power tools on the one side. And we say, well, then why don't we use the other hand? If you're able to, if it doesn't require a huge amount of dexterity and you're confident to use the other hand, change the other hand, and that's modifying the task. Or use both hands at the same time to take the load off the affected side. Restrict or amend your duties at work. Avoid lifting your arms at full reach. So the tendon gets loaded a little bit more when we've got the elbow straight. So when we have the elbow completely straight and we go to grip or we go to lift something up, the tendon gets loaded a little bit more. So maybe just go, and the physio can help you with this. Right, can we do this task of doing that with the elbow bent? And that will reduce the load slightly. And you may find the symptoms reduce a little bit then. Avoid gripping and lifting with your palm facing down. So this is another tip. So with your palm facing down and you go to lift things up or you go to grip things, it puts a slight bit more stress on the tendon. So we just modify it. We change the position of the hands, and people will be amazed at such a small little change that actually the aggravation of the symptoms reduce quite a lot. Alter the grip of your hand tools. So what we know is using it, maybe changing the size of the grip. So in certain hand tools, if we change the size of the grip, it can reduce the stress of the elbow structures. So it's kind of a play by ear, see what works, see what doesn't work, and it's individual to each person as well. And if it's possible, job rotation. So we know in general, if we're in a job that does do a lot of repetition, for example, or static positions, if we can change the job, so if we can do one job, change it and rotate as much as possible, you're modifying the load then.
So can I just make just a quick point about that last slide, Paul? Sorry.
Go for it.
So with these activity modifications, and again, this is reiterating a point that I've made previously, these are things that you can do to avoid a painful movement for a short period of time. So what we're not saying is, you have to worry about doing these tasks now. So if you're not in pain, if you haven't got lateral elbow pain, and you can grip and twist and move and do all those things that you want to do. You don't have to worry about those things now. You know, sometimes when things get painful, like your lateral elbow, like your lower back, you might have to avoid certain movements for a short amount of time, but that doesn't mean you have to avoid those movements forever. You know, we're not trying to generate any fear or worry around certain movements or certain activities. You know, if you're not in pain and you never have been with your lateral elbow, then it's probably okay to do. And like I say, you're probably in that sweet spot of good load rather than underloading or overloading. But as we said, these are activity modifications for painful elbows. So if you are in pain and certain movements are painful, definitely try and modify them for the short term. But don't be afraid about ever going back to them once the pain is gone and we've done some strengthening to make sure we're where we need to be.
Yeah, exactly. And that goes back in those psychosocial factors to where if you fall into that category, you start to be fearful of going back into normal movements, it'll develop worse. So the important thing is to go back to these activities once the pain goes down. Well said. Okay, Ash.
So we've got some interesting poll results actually. So 67% ultrasound, 0% laser therapy, 0% massage, and 33% exercise. So in everyone who's on the call now, your experience, most of you have found that the ultrasound's actually been the most effective for your pain. And when we go back to our presentation, obviously that's has been shown in the research to have relatively limited effect. So that's interesting that people have found that.
Definitely. So we know it has some short-term benefits, but really, and that's what this webinar is for, is to educate you guys to know what works with the evidence. And we know ultrasound is limited evidence, so changing that load, getting the exercise in is the best way to go. So this is as a summary. So load modification, exercise, stress management, reducing our stress, getting the right advice, they're your gold standards. They're where we need to go over tennis elbow. Then for your short-term relief, your manual therapy, your splints, straps, acupuncture, electrotherapy, and in combination with exercise, never as a standalone treatment. Really important. See if you can identify any solutions to potential risk factors. So if you're getting pain with those specific movements in work or in leisure, see can you reduce those risk factors, provide some solutions, modify them. If you seek healthcare advice for early intervention, so the earlier you get advice from us, so if you can't manage it, if you get this pain, you can't manage it yourself after say 3 to 5 days, then come into a physio, get it assessed, make sure we know what the diagnosis is, and we'll give you the right advice and tell you where you need to go. If it doesn't improve, so if you find you've done everything, you know, you've loaded it, you've gone through all those questions, you've loaded in every single way, you've been consistent with your exercise, you've taken all the advice, you've gone down that whole pathway with the physio, and after about 6 months or so, you know, you're not getting any improvement or it's getting worse, at that stage we probably recommend you go to your GP for advice on other options to reduce the pain. Right, so we have our IPRS Health app. So as we had said, we've got that exercise program. We've got that exercise program for the pain, the early stage, and we've got the exercise program for when you've gone past that very painful stage and you want to now load it and get it stronger. If you email either Ash or myself, there are emails you have up there. So paul@scallon@iprsgroup.com or ashley.james@iprsgroup.com. What we'll do is we will send you access to our app, and our app will give you access to that exercise program. It'll also give you access to some other resources which we'll talk about in a second. So simply email us and we'll give you access to the exercise program. If you feel you need more advice around the exercise, we recommend booking in with a physiotherapist to run through those exercises with you as well. These are general exercise programs. They're not exercise specifically targeted to the individual. So these exercises obviously are practice at your own risk, and we do recommend you probably get it assessed by your physio before you do the exercises. We've also got few other services. We've got some called our websites, so www.iprshealth.com. If you go into that and then you click on the news and blog section, we've got loads of blogs on all different areas, common injuries, musculoskeletal common injuries. So we had the shoulder recently, we've got a blog for the elbow, we've got loads of blogs coming up based on this whole what we're talking about now. So go onto our website, the blog is free. and you can have a go at that. I don't think I put it up to MyIPRS nothing. We've also got something called myipresshealth.com. And that is a resource for patients. It's an additional resource that we provide for IPRS Health patients. So it's a separate website, www.myipresshealth.com. And then basically what that is, sorry, I forgot, I didn't put that up, I should have put it up. That is a resource to where you can click on the body. So whatever injury you have or you're concerned about, you click onto the body. It'll give you all the different types of potential injuries you can get for that site of the body, and it'll give you loads of advice on how you can self-manage that yourself. When you go into www.myipresshealth.com, you'll be asked for a code, and we're going to give the code for everybody in this webinar. So there's a specific code that you're going to enter in, which is, Ashley, do you remember? Patient.
I'll get it up now. Let me just find it.
Webinar programs, I think it is, isn't it? So this is an individual, a kind of bespoke password just for people on this webinar. So once you enter in the passwords, there's loads of resources, videos, there's blogs, there's everything on it. So it's really good.
It's webinar program.
Webinar program. So when you type in webinar program, you get access to that. Again, you can also get access to myipresshealth.com via the app. So if you email us for the program, we'll give you access to our app. You'll get the program on the app, and you'll also get a direct link to myipresshealth.com. You can click on that, enter in webinar program, and you'll get all the resource. So that is pretty much everything. So, Ash, we're actually on time. So what I'm going to do is I'm going to unmute everybody. We can answer any questions if you want any questions answered. Just can I clarify, we can't answer specific questions about your specific condition because we have to be able to assess it in a confidential manner. So we can answer general questions about the problem, but we... All right, have you unmuted everybody? Is it?
I tried. Right.
You muted me.
I know, yeah. I was trying to be smart.
That's all requests then.
I just have to Sorry, it's quite noisy. Has anybody got a question they want to ask us then? If you don't want to ask a question, just mute yourself, and if you do want to ask a question, just unmute yourself. The other thing is we've got questions, we've got a tab, so if you look on your toolbar on the right hand side, you've got a question section, so you can click on questions and ask a question there, and we can answer it.
That's probably easier.
Might be easier because it's quite noisy actually, if we unmute everybody. So yeah, questions tab on the right hand side, just click on it, type in the question, we'll hang on here for a little bit, type in the question and we can ask any question that you want.
Okay, question has come in. So, good question. At what stage does it become a chronic condition? So, that's a good question. We would normally consider an injury that goes on for longer than 4 weeks a chronic condition. Anything that's happened between 0 and 4 weeks we would consider acute, and everything after that we would consider chronic. It doesn't particularly mean much, and we would even use the term persistent pain now rather than chronic pain, but it just helps us differentiate how long a condition has been going on for. So yeah, it would be after 4 weeks would be the question.
Perfect. I've just got another question. Somebody has just said they already have the IPRS Health app, and how did they get the exercises pushed onto the app? So if you email us, and what we'll do is we'll send a new access code, and you'll get the exercise program. Just with the exercise program, guys, when you email us, do us a favor, let us know which program you want. Do you want the program, if you're in a lot of pain, it's a lot of pain, it's quite a recent tennis elbow injury, we can send you the first program. If you've had this for quite a while and the pain isn't quite as bad, it's manageable, just let us know, and then what we'll do is we will send you the second program.
Yeah, I think that actually relates to the first question. So if you've had it between 0 and 4 weeks, you'd probably go for the first one. After 4 weeks, you're probably more appropriate for the second one.
Okay. So I think that's all the questions. Oh no.
There we go.
I think
That's
that was
good.
just a bit of feedback, wasn't it? Yeah. So we just got some feedback. Just having gone through all the various treatments in the past 2 years, I recognise a lot of points that you have talked through. So thanks for that feedback. And it really is just it's understanding your condition a bit more, getting the right advice, and be careful. Be careful of that Google, guys. Don't trust Google too much when you're typing in tennis elbow, because it may tell you your arm's going to fall off or something like that. So we're gonna wrap it up. So hope this has been a help to you guys. Again, you will get an automatic recording sent out, so you can view this again yourself at a later stage. Email us if you want access to the program. Get onto those resources on our website, www.ipresshealth.com, or onto the myipresshealth.com website for loads of resources. And get onto our Twitter at ipresshealth as well. We do loads and loads of blogs and info on Twitter specifically, and we've also got a LinkedIn page, IPRS group. Get onto our social media if you want any more help on any of these areas. And that's it. Cheers, guys.
Thanks, guys.
All right, bye-bye.